But first, News Channel 5 is on your side with an in-depth look at something that affects every one of us. In a little more than a week, people all over Northeast Ohio will be able to sign up for health insurance thanks to the Affordable Care Act, also known as Obamacare.
All week long right here on News Channel 5 at 6, we have a series of 5 on your side reports with everything you need to know before the healthcare marketplaces or exchanges open on October 1st. Consumer advocate Jonathan Walsh is kicking off our Understanding Obamacare series tonight with a closer look at who will be directly affected.
Yeah, and that's the big question everybody wants to know, right? And that's why we're starting our coverage with that question here tonight. The Federal Department of Health and Human Services says there are nearly 1.4 million people in Ohio, right here, who are uninsured and eligible to sign up. Are you one of them? The answer might surprise you.
In 2006, I battled ovarian cancer.
Bethina Glenn from Cleveland has a pre-existing condition now because of the cancer that invaded her body.
I have not been able to get health care for myself as a result of that.
Glenn is also raising her son on her own.
Even now I'm a single mom. My son is 6, and I have health care for him, but not for myself.
Glenn is finding herself in the pool of those who are eligible to sign up through the exchanges. Local experts say if you're more than 65 years old and on Medicare, you don't have to worry about enrolling through the exchanges. But if you're on Medicaid, because Ohio has not expanded the Medicaid program yet, you could need to sign up.
I expect that we're going to have a lot of people who, without that Medicaid expansion, who are not going to have coverage.
Other people directly impacted generally fall into 2 types of individuals, says Cleveland State Assistant Professor of Law Gwendolyn Roberts-Majette.
If you're a self-employed individual, you're purchasing on your own, you're going to go to the exchange, or if you work for a small business.
A small business is defined as 50 employees or less. Also, if you're not full-time, that is, you work less than 30 hours per week and don't have insurance, you can use the exchange. Plus,
if your employer doesn't offer it, you do go to the exchange. And employers are supposed to offer affordable coverage. So some employers might offer the coverage, but it's not affordable to the individual.
So what's affordable? The government says if your share of employee-only health care coverage is more than 9.5% of your yearly household income, then the coverage is not affordable. So, for example, if you make $50,000 a year and your premiums are more than $47.50, go to the exchange. If you are covered by your employer's insurance, then more than likely you won't have to do anything come October 1st. Glenn says she plans to sign up through the healthcare exchanges as soon as she can.
I'm definitely looking forward to sort of seeing some actual numbers and how that's going to play out.
Another interesting thing to keep in mind here is if you do not qualify for Medicaid or for the Children's Health Insurance Program, then look at the exchange. If you're unemployed and don't qualify for assistance, then look at the exchange. And people who need insurance altogether, the other option is for you to bypass the exchange and get your insurance directly from an insurance company or broker. So definitely a lot of things to keep in mind. Tomorrow, we are talking about what kinds of costs that the government will be covering for you and what subsidies that you could be eligible for. Big money.
Great usable information, Jonathan. Thank you.
You bet.